All right, we have heard of the problems that low testosterone can wreak on both men and women, but now we are learning some amazing things that testosterone therapy can help as far as a variety of medical issues. We have Dr. Angela DeRosa. She is a specialist in this field with a patient, Stephen, who's undergone this pellet therapy. This is kind of a miracle, isn't it?
Well, I think it being Christmas time, miracles are in order,
Yeah.
and Stephen is really in a miracle.
What happened to you, Stephen, a couple of years ago? You were rock climbing?
2 years ago tomorrow, I was rock climbing, and I fell off my rope 40 feet and broke my back, got a spinal cord injury, and was told that chances were very, very high that I would never walk again.
And by the way, you walked in here today.
I did walk in here today, yep.
So you meet the doctor here. What happened? What'd you do?
Well, Stephen came in, and a lot of patients who have spinal cord injuries end up having really low testosterone because of the junctions where those injuries occur and how they affect the testicular production of testosterone. So we wanted to certainly give him every advantage that we could in making his muscles strong and his neuromuscular connections, and testosterone therapy was definitely in order. I just went to a conference in Russia, and there's a lot of new research going on with Alzheimer's, Parkinson's, all these neuromuscular disorders, and how testosterone can be helpful. And Stephen had plateaued in his recovery, and since he's been on testosterone therapy, he's done a remarkable job, and we just published his case report in a national journal, in medical journal.
Wow, good for you. I'm guessing that this also took a lot of work, a lot of hard work.
Yes, testosterone itself is not the
Right.
catalyst, or it's not the end. It's a catalyst.
Right.
It's I always talk about it like gas in the tank. You know what I mean? I got to do all the work. I do 6 hours a week of physical therapy. I go to CrossFit every day. I bike several miles a week. But that would not be possible if I didn't have the ability to recover neuromuscular, and the testosterone has been, the main factor in my ability to do that.
You still walk with crutches. What's your prognosis? Will you be able to throw those away someday?
We don't know. I mean, that's the thing. Like, it's beautiful. Before I got with Dr. DeRosa, it was wheelchair, maybe standing and walking for therapeutic reasons, but really nothing in public. But now I'm walking with crutches in public, and who knows? I'm walking with a cane in physical therapy. I think I can get there, yes.
Good
I think
for
I can
you.
get there.
We're so excited
He's
about
amazing.
that.
Actually, my big goal is to be able to be the first paraplegic to hike the Grand Canyon rim to rim.
Really?
Yep.
Good for you.
I can't even do that, and I've never been injured.
Yeah, I think you'll make it from the sounds of things. So this conference, you talked about all these other elements.
Yeah.
Is that just now coming to light, or is this something?
Certainly when we look at hormonal therapies, the rest of the world is much more progressive than we are here. We're about 80 years behind the rest of the world.
Really?
And when we get together with a bunch of geeks like myself in this area, we really get down and talk about this stuff. And Parkinson's, there's a lot of great new research about their ability, because Parkinson's, these people get very rigid and they have difficult time with movement and walking, and they're showing great progress with Parkinson's disease with testosterone therapy.
Is that to say that if you were already on testosterone therapy for low libido or whatever other reason, that you would not have any of those ailments because of that?
Not necessarily. I mean, certainly we always think about testosterone associated with sex, but to me that's just a bonus. It's a nice kicker.
Right.
But that does so much more for us by helping us build muscle mass, by helping fire those synapses in the muscle, by helping glucose get into the muscle to help them be strong.
Right.
So testosterone really is not just for sex. This is much bigger than that.
And we have Stephen here, and we always talked, it seems like men, but it's for women too.
Absolutely. We make just as much testosterone as guys do, just in a little different balance.
Okay. Thank you so much, Stephen. The best of luck in getting across the Grand Canyon.
Thank you, man.
That you got to let us know about.
I will.
That is really terrific. And Dr. DeRosa, it's always great having you on. You're
Likewise.
awesome. Thank you.